So there's been some dramatic increases and improvements in terms of our ability to achieve sustained virological response or cure. And so just yesterday, a new treatment combination was approved in the United States. This is a combination called Harvoni, and it's a combination of lidiposphere and sofosbuvir, so an NS5A replicase inhibitor, and a nucleotide analog, NS5B polymerase inhibitor. And the combination of these two pills in one tablet, once a day, showed a very high rate of sustained virological response or cure in over 90% of patients. And what's particularly exciting about this new compound is that in a study that I led that was published in the New England Journal of Medicine earlier this year, 8 weeks of therapy with one tablet once a day achieved a cure in 94% of patients. And there was no significant difference between 8 weeks versus 12 weeks. So the latest information that was on the package insert, which is part of the approved label, demonstrates that in those patients that have a viral load before starting treatment of 6 million units or less, there were no differences in relapse rates between those that were treated for 8 versus 12 weeks. So these data suggest that, in fact, in the right patient population, genotype 1 patients without cirrhosis, 8 weeks of treatment may be completely sufficient. And that's very exciting because generally we write prescriptions for a month at a time. So here you're thinking about writing 2 prescriptions for a patient and achieving a 94% cure for a disease that otherwise would have less than 10% chance that it would spontaneously resolve. And then there are other treatment combinations that are being studied with as little as 6 weeks of treatment. And I think the holy grail, if you will, of treating hepatitis C is to come up with a treatment option that would provide cures with as little as 4 weeks of treatment. And there's a lot of active research underway right now to try to determine whether multi-drug combinations with 3 or 4 drugs might achieve that. And we are quite optimistic that at least for some patients, we might be able to eliminate the virus and achieve a cure with 4 weeks of treatment. But the 8 weeks showing high rates and comparable efficacy to 12 weeks is here now, commercially approved, and on the shelves today.